Hello, everyone. I'm Kaveri Myra. I'm a midwife researcher from India and a doctoral candidate at the University of Southampton, United Kingdom. I'm very glad to welcome you on our parallel session on the importance of healthcare workers in the COVID response, investing in midwives. We have expert panels with us today from around the world, and it's my pleasure to introduce to you our speakers. We have Jihan Salat, SRH specialist, joining us from UNFPA, Jordan. We also have Joe Moyer with us, who's the Deputy Director and Human Development Department, Global Health Directorate, Foreign and Commonwealth and Development Office, joining us from the United Kingdom. And lastly, we have Sandra Oyarzo Torres, Vice President of the International Confederation of Midwives, Associate Professor of Universidad de Chile, and also a board member with the Women in Global Health. I extend a hearty welcome to our expert panelists. But before we get to hear from them, I think it will be very interesting to interact with the audience for a little bit. As you know, this session is about frontline healthcare workers, specifically about midwives and midwifery. So we thought let's have a couple of questions and interact with the audience for a bit. So you will see two questions coming up on your screen. The first question. This one I think is very simple. You all know the answer to this, I feel. It's what comes to your mind when you think of what a midwife does. Is it a birth attendant, community leader, provider of sexual reproductive health care and information, or all of the above? I have a feeling the next one is going to be a little tricky. Right, shall we have our next question up then? Wow, a lot of you think that midwives can do all of the above. Surprising is also that nobody thinks we can be community leader. That is sad. Well, we definitely can be provider of sexual and reproductive health care information. We are definitely birth attendant. Well, I will tell you more about it when we start the discussion, but let's have another question. The next question is, increased investment in midwives is important because it can save up to 4.3 million lives annually by 2035. You have to answer how. Is it by averting 67% of maternal deaths or averting 65% of stillbirths? The second one is, there's a mistake in that one. It should be 64% of neonatal deaths, or reducing the number of abortions from 40 million to 25 million, or all of the above. So yes, while answering, please know that the second bullet is supposed to be averting 64% of neonatal deaths. But even before knowing the right answer, 4.3 million lives is a lot of lives annually, that too. So I hope you're, constantly thinking about investing midwives and how important that is while you're still answering the questions. Right, can we have the answer up then? Can we have the answer? %96 of you think that all of the above are possible when investment is done in midwives. That's the absolutely correct answer. Well, any of those you select is going to be the correct answer, but the last one is the most correct because, yes, absolutely, midwives can do all of that. So, with that, I think we should start our discussion and tell you more about how. So, I have this amazing panel, and I am really, really very excited about moderating it because it's just so timely. I mean, the world is paying attention to the frontline healthcare workers. The world is paying attention to midwives. Now, to all my midwife friends in the audience, how often do you get to hear that? The world is paying attention to midwives. Now, the pandemic has showed the importance of midwives and midwifery to the world in a very unique way. In 2020, that too, which was specially dedicated to midwives. So, while there are still misconceptions about who we are and what we do, there is a willingness to listen. Like, do we assist births? Do we provide reproductive and sexual health care? Are we community leaders? Well, nobody thinks we are. Are we researchers? Are we policymakers? Listen, we are all of it and more. Listen to the evidence of the impact of midwives and midwifery, that when allowed to perform the full scope of practice, midwives can avert 67% of maternal deaths, 64% of neonatal deaths, 65% of stillbirths. Midwives can save more than 4 million lives annually by 2035. But that is not possible at the moment because the world currently lacks more than 900,000 midwives, and mainly in the lower middle income settings. Now, midwifery is very important for every country and every culture and context, no matter where you're joining from. It's not just about averting deaths, it's all about women and newborn and children and families who deserve compassionate care, continuity of that care, care that is not over medicalized, women centered, and person centered. Now, the PMNCH's call to action on COVID-19 was issued in 2020, which has a 7-point agenda, and it brings over 1,000 partners together to advocate for urgent action to combat the devastating direct and indirect effects of the pandemic. Now, our session is particularly going to look into ask number 3, that highlights the importance of quality of care, including respectfulness and dignified care. And ask number 4 on strengthening the recruitment, education, pay, and safe working conditions for frontline healthcare workers, such as midwives. Midwifery is facing challenges in all these aspects at different levels, in different quantities and extents in different countries. And you can learn so much about that from the latest third State of the World's Midwifery report that was launched just last week on May 5th, the International Day of the Midwife. So listen as we discuss the findings of that important report today as well. Most importantly, we will talk about something we never talk about. We will talk about money. We will talk about investment and why my country and your country needs to invest in midwives. So listen and arm yourself with information from our expert panelists, and let's begin. Because I just mentioned the State of the World's Midwifery report, which was launched just last week, My first question is to you, Jehan. It's kind of a two-part question. The first point is I would like to know what the top three findings are from this report, in your view. And then, because we are still all in a pandemic, could you tell us what the impact of COVID-19 has been on the work of midwives? Over to you, Jehan.
Thank you, Kavari, for the question. I have read the report with great interest, and there are a couple of findings that stood out for me. Firstly, the fact that midwives could deliver up to 90% of essential sexual, reproductive, maternal, newborn, and adolescent health interventions across the lifespan. Despite this, they account for less than 10% of the global SMNH workforce. Secondly, in order to close the global SMNH workforce gap by 2030, which is in the next 10 years, we need 1.3 million new SMNH workers entering the global workforce. At the moment, we are experiencing a shortage of all types of SMNH workers, but the most significant gap can be found in the area of midwifery. As we speak, there is a shortage of 900,000 midwives globally. And looking at the current rates, it is predicted that there still will be a gap of 750,000 midwives by 2030. Thirdly, the report also shows the potential impact of midwives in preventing and reducing maternal mortality, neonatal mortality, and stillbirths. If we invest in ensuring that midwives are fully educated, regulated, and integrated within a multidisciplinary team, 4.3 million lives, as you mentioned, could be saved every single year. However, to enable midwives to achieve their full potential, we must address the impact of COVID-19 on both the education and health system. As you may have witnessed, midwifery schooling has been interrupted, with courses taught online, students lacking access to clinical placements and experiencing delays in completing education. We also see that essential SMNH services have been significantly deprioritized and disrupted. There's a shortage of qualified midwives. Midwives are working long hours and experience burnout and stress due to lack of there are also, lack of PPEs. Consequently, many midwives have died from COVID. Women have reduced access to SMNH services and are at increased risk of maternal deaths or morbidities. If anything, the State of the World's Midwifery Report, along with decades of high-quality evidence produced in the field of midwifery and the work of midwives before and during the pandemic, it makes one thing clear. Investing in midwives saves life. Therefore, it is up to us to use the existing evidence and data as critical tools to which to effectively engage policymakers and forces that drive healthcare to inform their decision-making and advocate for investments in quality midwifery care. Over to you, Kaveri.
Thank you so much, Jan. My next question is to Sandra. The majority of midwives, including in the other healthcare providers at the front line as well, generally, are women who face gender-based discrimination, including disparities in pay and career opportunities, as well as sexual harassment and violence. Could you share a regional perspective on how these issues have been addressed in Latin America and the Caribbean?
Thank you, Kaveri. Well, first of all, I would say that eliminating all forms of gender-based discrimination in social institutions requires long-term commitment. However, by introducing gender-responsible policies and programs and removing discrimination in legal frameworks, countries in Latin America and the Caribbean could gradually reduce or leverage gender-based discrimination. Professional Midwives Association of Latin America and the Caribbean, ICM members, have expressed their concern about violations of the reproductive rights of adolescents, women, newborns, and professional midwives, which are manifested in some countries in the absence or the lack of protocols of fertility regulation, pregnancy, birth, and postpartum care in the framework of the COVID-19 pandemic, or the use of medical public health guidelines that are not based on evidence. Therefore, midwives have called on governments through its statement to recognize the importance of women's sexual and reproductive health, including maternal, newborn, and child health services, emergency contraception, family planning, pregnancy termination services where legal, and clinical management of sexual violence as a part of essential life-saving services during emergencies, disasters, and pandemics. Include professional midwives in the preparedness response and recovery phases of risk and disaster management programs, and consider them as part of the healthcare teams to be deployed during the health emergency. Include chief midwives at Ministry of Health as a key driver of change regarding sexual, reproductive, maternal, neonatal, adolescent health. Recognize all professional midwives as frontline providers of care and therefore provide them with PPE, ensuring their access to sanitary measures and safe, dignified, and respectful working environment. Besides these statements, midwives in Latin America and the Caribbean have been advocating together with women's groups to ask parliamentarians for the recognition of unpaid care work. This is critical for the evaluation of women's economic contribution. Redistribution and reduction is a key to narrow persistent gender gaps in the workplace. Making unpaid care work visible and a priority in Latin America countries and the Caribbean will promote women's economic contribution. Midwives have also joined healthcare unions or federations with other healthcare professionals to fight together for their rights and also for the recognition among healthcare teams at country level to stop discrimination from OBGYNs, nurses in some countries of the region. So, on the other hand, women's leaderships in healthcare has been another issue to consider in Latin American countries, where women make up 73.2% of the total number of people employed here. Low investment in this sector strongly affects working conditions. Midwives have been working to build the first Women in Global Health chapter in Latin America to advocate for positions of leadership in healthcare. As an example of the work done among midwives associations, ICM, and Women in Global Health, we have the first midwifery director at the Ministry of Health in Chile. There are 4 in the world: United Kingdom, Kazakhstan, Paraguay, and Chile. 2 chief midwives in Minister of Health in Latin America. So it is time to start advocating for more chief midwives in Latin America. If you have midwives, women with women, in the decision-making positions, there will be a change to start the change that we are looking for. Thank you.
Thank you so much, Sandra, and many congratulations that you have a chief midwifery officer in Chile now. I hope that happens in my country too soon. Let's move to our next speaker, Joe. My question to you, Joe, is about global policymaking, as Sandra has also touched upon. Could you tell us, at the global policy level, what needs to be done to advance midwifery? Over to you.
Oh, thank you so much, Kaveri. Really appreciate the opportunity to be on this panel today. It's called an expert panel. I think Sandra and Jehan are experts. I'm not sure I put myself in that category, but delighted to be here. So I think the first thing to say is that the contribution that midwives make, I think is increasingly becoming recognised, both the contribution they make towards health overall, but also, and very importantly, for gender equality. And I think, for example, we saw this in the 2019 Universal Health Coverage Political Declaration and the 2019 Astana Declaration on primary healthcare. 2020 was also an important year as the year of the nurse and midwife, and 2021 is proving pivotal. We've just heard a little bit from Jehan about the State of the World's Midwifery report. So the stage is set for us to do more, and particularly so, as you said, Kaveri, because of the challenges that we're facing with the COVID-19 pandemic. So just a few thoughts on what more we can do as policymakers. So first of all, I think there is real value in sort of global resolutions, globally agreed norms and standards relating to midwifery and primary healthcare. And I'm delighted that the forthcoming World Health Assembly is considering adoption of a report of global strategic directions for nursing and midwifery 2021 to 2025. These are really powerful strategic directions, which we can all use as hooks to promote further debate and further investment in these areas in future. Second, I'd focus on quality midwifery education. And in particular, WHO and UNFPA have played a huge leading role in this space. We now have high quality frameworks and tools, including the WHO's 2019 Strengthening Quality Midwife Education for UHC. It's a 7-step action plan, which has set the stage for how we can scale up quality midwifery education. And then there's also the exciting midwifery education toolkit, which is a blended in-person and online midwifery learning resource. Of course, online resource is so important these days with travel restrictions affecting many of us still. And finally, we can also promote the new global monitoring framework for midwifery produced by WHO with the ICM, UNFPA and UNICEF. So there's a whole range of things that we can do there to promote more quality midwifery education. The third is jobs. We need to increase the workforce. We've touched on this issue already. Jahan touched on it. Increasing midwifery skills within the midwifery workforce, but also the number of midwives, creating jobs, managing retention, managing international mobility and migration, but in an ethical way. And actually the WHO's international workforce policy here is really helpful, the new code that was published earlier this year. Fourth, and again, Sandra touched on this, midwifery leadership, absolutely crucial. We need midwives in leading roles within government, within our health institutions, and that promotion of leadership skills is really embedded into midwifery education. Mentoring and training here is really helpful. I'm sure many of us around the table have benefited from mentoring. It's absolutely crucial, isn't it, for unlocking confidence and the ability to see beyond your own horizons, perhaps. Fifth, I think there's scope to expand midwife-led improvements to service delivery to ensure that those trained and deployed are able to use their skills to the fullest extent, in particular that they work in healthy environments with good water and sanitation, that they have PPE. Other speakers have already mentioned this, but unless you have a good working environment and you're able to call out, if you do not have that, then there will always be limits to what you can achieve. And then finally, I think this is perhaps almost the most important point, promoting respectful maternity care, quality maternity care, which treats women with dignity and respect, means that they are free from violence, protects their confidentiality and their privacy, and ensures freedom from harm. It's so important. We know that all too often women going through labour and childbirth have really not very good experiences, and this is the world over. You know, I'd include my own country in this area. So really promoting that respectful maternity care, good quality of care is absolutely key. I'll stop there. Thank you.
Thank you so much, Jo. Those are some really excellent points. I don't know how I'll pick like one or two of those in my closing up summary, but absolutely promoting respectful maternity care, I think, is my favorite. I'm doing a PhD on obstetric violence in India, and I completely understand how important that is, and midwives are required to do that. So while we end our first round of questions there, let me remind our participants, our audience, that you can post your questions in the chat and we will pick up after the next round of questions, as many as we can. So the next round of questions are completely focused on investment in midwives. And I will start again with Jahan. Jahan, what investments are needed, according to you, to better equip and empower midwives in humanitarian and fragile settings? How can midwives and other advocates influence decision-making and discussions about how resources should be allocated and managed to strengthen midwifery? Over to you, Jahan.
Thank you, Kaveri. That's a really good question. Those are two questions also, so I'll make sure to touch upon both questions. Well, to better equip and empower midwives in humanitarian and fragile settings, investments are required in 4 different areas. Firstly, investments are needed in health workforce planning, management, regulation, and work environment. We need high quality data about the health workforce. The scope of midwifery practice needs to be clearly defined, and restrictions placed on the delivery of midwifery care should be removed. Secondly, investments are required in high quality education and training of midwives. Joe touched upon this earlier. Funding should be made available to support pre and in-service training and the regulation of midwifery education. Also, there should be an equitable distribution of learning and teaching resources and availability of midwife tutors, teachers with adequate teaching competencies. Thirdly, investments are needed in midwife-led improvements to SRMNH service delivery. We need to design perhaps a midwifery service delivery model specifically for humanitarian and fragile settings. We need to build the trust between midwives and the community they serve. Also, specific lessons from the COVID-19 needs to be applied to build community and institutional resilience. Lastly, I believe that investments are required in midwifery leadership and governance, as Sandra and Joe already mentioned. We need to ensure effective participation of midwives at all levels of policy and decision-making. It is crucial to facilitate access to knowledge, access to skills building, and access to opportunities for midwives to influence SRMNH policymaking. There are a couple of ways in which midwives and other advocates can influence decision-making. First of all, meetings can be arranged with government officials, stakeholders, to discuss issues such as shortages of qualified midwives, retention and deployment issues, education and training, working conditions, safety and security issues, and workforce data gaps. Perhaps virtual meetings can be also organized with Midwifery Association members and other healthcare professionals to discuss the findings such as in the State of the World's Midwifery Report, as well as the study that was released last year, December 2020, on the impact of midwives. Collaborative partnerships can be established within the communities. Midwives can participate in committees up to the villages and collaborate with community leaders, community-based organizations, as well as local authorities. Midwifery associations can also work with other professional associations. They can work with academia, parliamentarians, and other stakeholders. If there's no midwifery association, you can help to create one. And if there's already a midwifery association, you can join them or you can partner them. You can support them. Whatever initiative or platform is used to advocate for midwifery, it is important to work with local actors who share a similar vision, who are in it for the same cause. It is also crucial to use the latest data and evidence on midwifery and engage in continued dialogues and conversations with decision makers, with stakeholders, to generate and mobilize the necessary support, the political support to address challenges and gaps in midwifery. I believe I covered both of those questions, so over to you, Kabir.
You have, thank you so much. I am hearing about the importance of midwifery leadership in policymaking to influence parliamentarians from all the speakers today. So let's go back to Joe now. And I have a very simple and easy sounding, but a very difficult question for you, Joe. Is investing in midwifery a good buy given competing resources?
Thanks, Kaveri. So I'm glad you asked me this question. Of course, there are always very difficult trade-offs to be made when looking at finances. But yes, I mean, I think the answer is clear. Investing in midwifery is a good buy. And let me give you 3 reasons. First of all, I think you've got to look at the range of benefits a midwife brings. So we know that a midwife not only provides antenatal care, labour and postnatal care, but also she or he is skilled in other services, family planning, nutritional care, being able to sense if a woman has been subject to violence, and to help her deal with that, mental health issues. All of those are right at the forefront of primary healthcare. And of course, that in itself, primary healthcare, is absolutely key to universal health coverage. Midwives are often very trusted by their communities, and as such, they can have a huge impact, not only on the health of the women that they're serving, but also on the wider family, on the children, and indeed on the partners as well. Second, and this is something we think about quite a lot in FCDO, when you invest in a midwife, you're investing in the health system. It's almost as if investing in midwives is a proxy for investing in health systems because of that enormous contribution that midwives make. So when we contribute to building up a responsive and quality midwifery workforce, it really can be pivotal in strengthening that health system. So it's really important to make sure that midwifery skills are core to any human resource planning for a health system. And the third reason I think it's a good buy is the evidence of impact. So we've touched on this already, but a few more statistics. A study of 88 countries that account for the vast majority of the world's maternal, newborn and stillbirths estimated that with universal coverage of midwifery, we will save about 4.3 million lives by 2035. So we've touched on this already, but it's such a powerful statistic, I think it's worth repeating. And we know from the Disease Control Priorities 3 project that skilled birth attendance is highly cost effective. And finally, there's the wider lifelong social returns that you can have. So for instance, breastfeeding. We know many midwives promote breastfeeding. It's a sort of core part of the skill set. And breastfeeding improves IQ, it improves school attendance, it's associated with higher income in adult life. And indeed, 820,000 children's lives could be saved every year if all children under the age of 2 were optimally breastfed. So this is there's a huge social and health return for investing in midwifery. Thanks.
Thank you so much. We have around 10 minutes in the session, and I have one planned question, and we'll see then if we can take any questions from the audience. So my last question is to you, Sandra. What role can the International Confederation of Midwives and country and regional midwifery associations play in guiding state and national governments to increase investment in midwifery that is tailored to a country's needs?
Thank you, Kerry. Well, ICM's role is key in advancing investment in midwifery at country level throughout our regional work with board members. We have board members at regional level. ICM regional teams are going to be supporting board members' work. That's a team, Midwives associations based on ICM strategies, of course, that we have for this triennium. First of all, we are working really strongly to develop, strengthen, and support the rollout of a new professional framework that is going to support all this, wider work of the midwives throughout the life cycle, promoting especially midwifery as an autonomous profession, different from being a nurse or from being an OBGYN. We are midwives and we do midwifery. So we want to really highlight that. And of course, if we have midwives that do midwifery, we also be chief midwives at the Ministry of Health, helping, to really have this new strategies working at the country level. Of course, facilitating an enabling environment for midwives, we really need that, an environment free from violence, from sexual harassment. We want to be safe at the place that we work. So we are really supporting that at ICM and associations also. And we want to really highlight that and give the voice, when we're working at country level. strengthening midwifery education, regulation is really important. We have to be really regulated. So ICM is really doing hard work, and midwife associations highlight that also, because we can have many, nice documents, but if we don't have regulation and a strong regulation, it's really hard for us to really have a strong work. Strong associations that is really important, and of course leadership and a model of care that is midwifery care. And of course, synthesized and drive research and evidence are essential for us to work based on evidence, and of course, throughout our midwifery competences. And on the other hand, we also want to foster a movement for midwifery, enabling and strengthening partnerships, as everyone said before, advocating and communicating all the key importance aspects regarding midwifery, and of course with women, because midwives mean with women. So we want to be with them, and putting their voices at the center, and of course our voices, because the majority of us are women. Advocating and communicating, influencing policymakers, as everyone said before, and of course we want to really highlight the importance of the impact, that would mean at country level to have more midwives, and use, of course, effective and equitable relationship to build and support the profession of midwifery and expand the influence of ICM and of their partners. Build up partnerships between women and midwives from the individual level that we have, face-to-face when we are at the clinic, when we are in the hospital, but we want to get this partnership stronger, with more women, with their families, with the community, and of course at a global level, like right now that we're sitting here, we're all partnering for midwives and for women, because we want to, of course, advocate for women's rights. That's really essential, for empowering women, that we need that, of course, for respectful care and gender equality. And of course, to support parity between midwives, among midwives associations, among, of course, midwives that maybe are working in different countries. And right now, we really have a key opportunity when we can connect this in this way, communicating, through internet or through, phones. Strengthening partnerships between midwives and other stakeholders, including global and national policymakers, other health professionals, obstetricians, pediatricians, nurses. We want to be partners. We don't want to be, and not being partners at in some places like in Latin America. We want to change that around. We really are a team. We want to work together and also putting women at the center and advocating for, changing all this situation right now. And of course, we want to partner with traditional caregivers and other healthcare workers and associations, partners across different sectors, as everyone said before, especially women's rights and UHC. And of course, we really want to highlight the importance of this gender equality lens that we have to have. So this is for us really important. Thank you.
Thank you so much, Sandra. We have 5 minutes left, and I see there are a few questions there. There is a quick one. There's one to me even. Bridget from White Ribbon Alliance UK is asking me, I have heard you can sum up the SOMI report in 2 words, fight patriarchy. And she says, do you agree, Kaveri? I absolutely agree. I agree with it so much. After the end of this session, I might get it tattooed on my back or something. But the next question, I think, let's take just one at least. It's a little big one. And Sandra, could you respond to this in like a minute, if you can? So the question is, as the panelists noted, so many of the challenges facing midwives are rooted in gender inequality. What are some of the ways we can better connect and partner with gender equality and feminist groups to elevate midwifery on their agendas, especially with Generation Equality Forum fast approaching?
I think, being partners like right now, I think that's what we're doing. We're, building this movement around the world, around Latin America, and of course, through our different partners, like right now, women, all the ones that we're, sitting here today, we're being partners for this. So that's the only way I think we're really going to change. And also having the lens of gender and really trying to stop this. We don't want to be 135 years back. We really want to go forward. We want the children, the adolescents to have a new way of living, a new world. In the absence of violence, having all the chances to decide when they want to be mothers and have the right to study, and of course we want midwives to be safe. So this is a time to really have the voice for women. We need more midwives, and chief midwives at the Ministry of Health, because they're really going to make the difference. We want more midwives at the community level. We want more midwives, and we want to partner with women. That's the place that we want to be, because we're there every day. We are looking at our eyes when we talk to women, and we are feeling that we have the time and right now to really make the change. So let's be there. Let's all be there together and partner for this new way of doing things in life.
Thank you so much, Sandra, for those beautiful words to end this session. I think we should quickly wrap up. And I have no idea how to do that because you have touched upon absolutely everything from around the world. But I think it suffices to say that it's a big yes to investment in midwifery for midwives, no matter which country we are in. We have also heard about the range of services that midwives can provide, which makes it, of course, such a great investment for every country. We understand the importance of midwifery leadership that all of you have touched upon, and leadership, decision making role, policy making role at every level to influence parliamentarians and other stakeholders and be one of those key active stakeholders. We have also touched upon the importance of associations, and we have seen how important that is even in humanitarian settings. We have learned that we need a new model of care, particularly for humanitarian and fragile settings. We have touched upon the importance of the guidelines and monitoring frameworks that are coming up for midwifery education and practice. We have talked about jobs, we have talked about sexual violence, harassment, the burnout, the deaths in the COVID, and the important role that midwives play in the range of care they provide. So, with that, thank you so much to our panelists for joining this session. And I will request everyone to please join back in the main session. Thank you so much for joining us in this very, very crucial session. Thank you so much. Bye-bye.